Hello everyone, I'm Dr. Tarun Bhatnagar. I'm a senior consultant respiratory and sleep medicine in Venkateshwar Hospital, Dwarka, Delhi. So, as you all know, tuberculosis or TB is a curable disease. When we take our medicines regularly and eat a good diet. However, if we are not taking the medicines regularly, there are many complications that are associated with it. The most important complication that is associated with untreated or partially treated tuberculosis is MDR or drug-resistant tuberculosis. What it causes is it makes the tuberculosis difficult to treat. You need more medicines for the treatment of tuberculosis, hence more side effects. In untreated tuberculosis, the patient may develop breathlessness leading to COPD. Sometimes the lungs gets destroyed and the patient may have recurrent blood coming from his mouth, which is known as hemoptysis. Sometimes the patients may develop scar carcinomas or in fact fatal ARDS or acute lung injuries leading to death. Hence, you should take the medicines regularly. So tuberculosis is basically an infection that spreads by droplet infections. Means when you cough, when you spit, your cough and spit has got the tuberculosis bacteria, and they are potentially infective to other people. So, especially in healthcare settings, what we need to do is the patients, they should always cover their face, their mouth with a cloth while they cough. They should not spit anywhere. They should use a sputum mug to spit if they have anything. The healthcare workers, especially the nurses and the doctors, should wear protective PPEs or gowns when they are dealing with such patients. Ideally and importantly, they should always wear a mask when they are going in contact with such patients. The hospital should have rooms that should have laminar airflow, or they should have negative suction rooms. These are the basic preventive mechanisms for the spread of tuberculosis infection in the healthcare settings. This is an era of digital age and social media. So many apps have been developed by various agencies, including government agencies, for the betterment of tuberculosis patients. Now these apps help the patients, number one, to have the medicines. Then they burst the myths regarding the tuberculosis medicines and the spread of tuberculosis, and hence helps the patient in the better understanding of the disease. The patient can stay connected with their doctor, especially those patients who live in difficult to reach terrains or sometimes the patients are too ill to come to the hospitals, so they can stay connected with their doctors through the telemedicines, and hence they get proper guidance from their doctors. The social media is the center of the tuberculosis control. It helps us to create awareness about the tuberculosis, its spread, its treatment, and its outcomes. So all these measures, all these in fact products, using apps, using social medias, using telemedicine, they have helped improve the outcomes in the treatment of tuberculosis patients. So my message to all my patients is that tuberculosis is a curable disease. You should take your medicines regularly and eat a good diet, and you will be cured 100%.